Welcome, everybody, on day one of Davos. I hope you had a good day so far. Thank you for joining us, and thank you for Greek House for hosting Weber Shandwick for this important discussion on navigating disinformation and misinformation in public discourse in 2024. I am Katherine Docampo. I am Senior Vice President of Leadership and Impact Communications at Weber Shandwick in Geneva. I'm of Greek heritage, so I'm proud to be here at Greek House, and a WEF veteran, having just left the World Economic Forum as a staff member for the last 12 years. So it's fun to be on the outside. And let me introduce the panelists. We have a great lineup that'll provide some diverse perspectives on today's topic. First is Emanuele Capobianco, who's the Chief Strategy and Impact Officer of the World Health Organization. Next is Professor Olivier Oullier, founder and CEO of Inclusive Brains and a former colleague of mine at the WEF. Maria Montero, thank you for joining us, is a communications expert and former broadcast journalist. And finally, Deri, who's head of our corporate advisory businesses at Weber Shandwick. So just to set the context for today, obviously the topic of mis and disinformation has been on the Davos agenda in recent years, but 2024 looks a little bit more complicated, of course, with the acceleration of AI and the fact that almost 80 countries globally will host elections this year. So obviously, we will all be having to navigate a much more complex environment where it'll be harder to distinguish fact from fiction and generally a post-truth era. The WEF obviously has picked up on this themselves with having published the risk report last week. I don't know if some of you saw that, but they've cited mis and disinformation as the greatest near-term risk in the next 2 years that we all will have to kind of understand. So hope today will shed some light on this. I'd like to start with you, Emanuele. Tell us, what does this topic mean for you? What's on top of your mind, especially when it comes to mis and disinformation in the global health sphere?
Good evening, everyone, and Eucharisto to the Greek House and colleagues hosting us tonight. For me, when I think about disinformation and misinformation, I think about 2020, 2021, 22, and COVID. And when I think about disinformation, misinformation, I think about the fact that misinformation, disinformation cost lives, cost money. The misinformation around vaccines at the peak of the COVID epidemic costed to the US $50 to $300 million a day in life lost, in hospitalization, in long-term consequences on people that would be affected for life by long COVID. And it cost lives. In a study in Canada has demonstrated that 200,000 people were affected by COVID due to misinformation because they refused the vaccines. That led to 13,000 hospitalization and around 3,000 deaths. So misinformation costs lives, misinformation costs money. And I just wanted to spend 1 second just to make the difference between misinformation and disinformation, because it's important. The misinformation is just wrong information being circulated, and they need to be corrected. But is because information is not made public, but there's no intention to deceive. Disinformation is when deceit comes into place, when the information is misused to influence certain outcomes. And I think these are two very different aspects, and I look forward to discussing with the rest of the panelists to look at, because the response to the two are very different.
Fantastic, thank you. Olivier, you gave me permission to call you our resident geek, bringing a much more of a scientific neuroscience perspective to this. I was wondering, what does this topic mean for you? Especially, I think it's one thing to send misinformation or disinformation. It's another thing for our brains to receive it. So wondering if you could give us your perspective on that.
From a psychology and neuroscience perspective, what matters is the frame of reference. And let me speak as a former French kid. If I hear about mis and disinformation, I don't think about COVID. I think about weapons of mass destruction. I think about the Chernobyl cloud that the French government told us that it stopped at the French frontier. Yeah, they did. And I also think, sorry to be provocative, but the frame of reference really matters. Every Sunday in millions of churches, there is misinformation, scientific misinformation about someone who walked on water. Yet that misinformation has brought a lot of hope to a lot of people. And it all depends on a frame of reference. Some things that I told in certain contexts that are inaccurate can be helpful. And the frame of reference is what is going to trigger the way our brains process this information. Then the messenger. And back to your point, Emanuele, what we saw with COVID is the fact that scientists, physicians, were somewhat less believed than some voices on the internet, some influencers. And the new era that we're entering, for me, is not an era post-truth. There's always been manipulation of information for good or bad purposes. It's a change in velocity. It's a change in magnitude at which this information is spread. And the fact that our brains are not used to processing this amount of information, and some of the cognitive biases that have been at play on our brains for centuries still operate. Recency effect. The last person to speak is always the last person to be believed in a lot of contexts, be it a dinner or on the news.
All right, well, I guess we'll have a competition for who gets the last word on this panel. I think a lot to come back there too, but I'll go through all the panelists first, and then we'll dive into some of the issues. Anna Maria, you served many years as a journalist, and so like Olivier said, misinformation and disinformation is nothing new to you. So I think if we're kicking off this initial round in a bit of a historical perspective, can you kind of tell us what has been your experience as a journalist with this topic?
Well, also, thank you again for having me, and it's great to be in the company of such esteemed geeks, etc. Although this frame of I have to say, this frame of reference comment that you make is very interesting. I'm looking forward to hearing more about that, because in my search, because as a journalist, I never stopped being. I just stopped having a platform 3 years ago, but I don't think I ever stopped being a journalist in the way that I think, in the way that I process information and disseminate and discern information. And I think that if I think about this comment also, that misinformation, disinformation, none of this is new. This has been going on forever. I think about going back to journalism school, where, journalism 101 is check your sources. Check your sources. And we had a rule of 3. We had check 3 sources. And that's something that I still do. I'll see something pop up on CNN and I'm like, I wonder what BBC is saying about this. And then I check BBC and then I'm like, and what does Associated Press say about this? And what does Reuters say? Sometimes I get carried away. But my point is that I think that it's still something that's just very important to do. There are a lot, especially with more and more media out there and more clash of information, that you really take the time to confirm these things. And I think normally, if you get 3 or 4 out of 4, I think it's probably true. Yeah.
Great. Chris, you talk to chief communication officers and other C-suite executives day in and day out. What do you see? What is keeping them up at night? And is 2024 making them particularly anxious around this topic?
So I'd like to not accept the exact premise of your question. I'd like to suggest what should be keeping them up at night. I was thinking about this, right? And I do think, as an agency guy, basically, what are my clients doing wrong? What should my clients do? And I was thinking that there's really 3 things that come to mind. The first thing is organizations, multinational companies, government institutions, public health authorities. They show up in the world based on how they organize themselves. And the way they organize themselves is in very neat boxes where they put people and roles and responsibilities, usually around particular stakeholder groups, customers, doctors, patients, investors, right? And then engagement activities, digital, online, offline. So they've got this nice, neat organization, and then that's the lens through which they look at the world and show up in the world. The problem is that's not how the world is organized. The world is increasingly organized. Thousands of years ago, we were organized as tribes. Now we're organized as networks. And networks have participants from all those different stakeholders groups, and they're showing up in any platform, online or offline they want. So we got to think about networks in terms of the operating environment. That's number one, and that's hard for big organizations to do. Number two is, as we work with our high-paid consultants to craft beautiful narratives that we want to project, we got to understand what's out there in the wild in terms of current narratives and counter narratives, because if we don't understand those, we're not going to have resilient narratives. So we got to engage and understand those. And then the last one, it's actually about everybody in this room, and I say it to myself, and I say it with humility. I think that we're all pretty arrogant, and I think that we got to take a much different approach to the consumers of misinformation, and we got to stop judging them. And we got to actually take, I would say to the scientists, a basic science approach and really understand root causes. We do some talk about that, but what's the root cause for why there's so much consumption of it?
I'd love to pick up on that and turn to Olivier. And with no judgment, a couple years ago, you saw a couple news stories of people who had swallowed bleach in order to cleanse themselves of COVID. I can't remember exactly. But tell us, what goes through the mind? Like, how does, from your perspective, someone actually believe that bleach, by reading a newspaper, a Facebook post, that they should drink bleach?
The messenger matters. For those of you who don't remember the story, former President Trump, during the COVID crisis, alluded to a potential curing of COVID by ingesting bleach. This is fake medical news. I think we all agree. This fake medical news is also real political news. The same event, seen through two lenses, is real information and fake information. Yet, with the best intent at heart, journalists around the world spread those news. They communicated, do not do it, despite what President Trump said, do not do it. What do you think happened? For previous research, I worked with poison control centers in the US. So a few weeks after, I called the contacts I had in poison control centers. Guess what? The day after this news got spread, there was a peak of people calling to ask how they could basically be helped because they tried bleach. Would these people have tried bleach without the news being spread? Very unlikely. Some people drink bleach, but it's not very common. But the peak that was observed after this news got spread, this fake medical news, yet real political news. And the problem is that the messenger matters. Guess what? 100% of the people who drank this bleach were supporters of President Trump. Thought that the mainstream media going against President Trump by saying, do not listen to him, it triggered them to listen to President Trump. Maybe they wouldn't have without this, again, the right message as far as I'm concerned, and many sane people are being concerned. This is a sane message. Say, do not listen to a person who tells you to drink bleach. But then there was the opposite effect. And this is where responsibility of not only the first messenger, but the second messenger is so important. And where, for once, we had a behavioral measure of the impact of journalism on people's behavior.
I was going to say, you're looking at me. So you mean the second messenger is media?
Yeah, it's media. The first one is the source. And you can triple check that source. It happened.
Yeah. I want to, so I was going to come to Emanuele, but perhaps you could just comment on that one, Anna Maria. When you, as a media, as a journalist, how do you handle that, right? How do you handle the fact that you're telling us, you're obviously amplifying a story that you know will bring people false medical news, but you need to cover it because that's the story?
Mm-hmm. That's never easy. I mean, it sounds like a cop-out answer, but it really, yeah, it's always a double-edged sword. It's always going to be like this. I mean, you know, you're reporting on a story, and even if you are just strictly reporting the facts, then you are still telling that story. You know, and unfortunately, sometimes, and I admit this too, that you know sometimes media has a penchant for drama, you know, and for discussing, you know, I can't speak on behalf of all media, and I certainly, but I feel like, you know, sometimes unintentionally we do add oil to the fire, but it's because it's difficult, you know, it comes down to you want readers, and news outlets want people to click, and they want to be heard. And if you don't cover a story that everybody else is talking about, it's, you know, you've got to really be able to make your case to your editor.
Yeah.
Herding effect, another cognitive bias.
What is it?
Herding.
So
Well, someone does it and everyone does it.
yeah, the herd. Yeah. So we have a global health expert with us, and so I'd love also your take on what you've heard so far, what this meant for you in your career working in global health. How do you navigate, you know, working with the right influencers, getting the right information, come in as you'd like to.
So I just wanted to add a couple of elements to the equation. So there is the messenger, but there is the content of the message, and then there are the listeners. So the content of the message, and it's part of the complexity that we live in science, can change over time. When COVID started, it wasn't clear whether it was transmitted by air or whether you could get it by touching a surface. At that moment, the information that was going out was an information that was not based on certainty, but it was managing uncertainty, and makes it very, very complex. The more evidence then is created, the easier in theory is to pass a message. So at the beginning, there was a lot of uncertainty before the vaccines came out about their effectiveness, but then the amount of evidence grew, so you had the content that was solid. It works, it saved lives and percentages. But then what happened is that the messages started being used, and here we go in the disinformation, by people who were no-vax and pushing an agenda against vaccines. And there is where you need to really look at how to debunk and how to communicate, identifying the different listeners on the other side, and in changing the messages based on the various listeners. And I think that's the biggest challenge when you do have speaking to the public. And that's where the critical point, and the word has not come up yet, but I'm sure it will be coming, is rebuilding trust. Yeah. And it's trust between politicians and civil societies, is trust between media that are actually trusted and people, and it is trust between medical and paramedical and individuals. All of that got broken dramatically during COVID-19. And as we know, trust takes ages to build. It goes in 1 second. So there's a lot, I think, that needs to be done to rebuild that trust. And it's a long road ahead. And having now misinformation potentially powered and turbocharged by AI is, I think, a massive challenge that we have to face.
Chris, coming to you, obviously, Emanuele spoke about the importance of the messaging and communications, and I think, I know we have some communication executives here today, and their role is changing day by day in terms of their importance for navigating this and bringing their companies through it. Can you tell us what you see from your perspective on that, and then also adding into the equation AI, how that is all playing out in the communications department?
Yeah, I want to respond to Olivier's case with a tactical case that we did that I think is relevant. We worked for a very large public health organization, and they needed to get out basically public health, pretty typical public health messaging. This was post-COVID about seasonal flu vaccines and COVID boosters, right? And the scientific expertise said, really, this should be packaged together, right? For all reasons that you know as a medical doctor and things like that, it should be packaged together. So the experts said that's what our narrative should be. It's based on fact, it's based on science, all that stuff. What we did was we did apply our sort of AI-backed analytics, and we looked at the engagement and the narratives that were already existing around our communications around these two areas. And what we found were two significantly different conversations. Okay, flu vaccine, kind of maybe I should do it, maybe I shouldn't do it, does it matter, things like that. COVID vaccine, all the misinformation and disinformation and conspiracy theories of the anti-vax movement. And so again, super tactically, but I'm going back to Olivier's message, right? It's like, geez Louise, like, don't drink bleach. That's really, that's the message. But what we did was we parsed the message and the narrative so that it would be resilient in the wild. And we did not do what probably made the most sense simply from a scientific and health standpoint, which is, go do both, and here's the connectivity. We had one campaign about flu vaccine and one about COVID, because the COVID was going to pull the flu vaccine campaign into the vortex.
Did you want to respond to that?
Yes. Never listen to a physician when it comes to communicate.
Right. Yeah. But you can't undermine their expertise. That's the balancing act.
They're experts about healing the human body.
Right.
But they are not good at engaging their own patients. The people who understand how we behave, how we engage, and how to re-engage us do not work in medical facilities. They work at Walmart. They work at Netflix. They work everywhere in the consumer industry. And one of the biggest problems in healthcare systems is to think that the people who own the science, who own the medical truth, know how to communicate it. You mentioned about debunking. I learned one rule about journalism is a rumor and a denial equals news. It's exactly the same with...
Not all the time. Come on. Come on. That's a little harsh.
I saw many governments. We recorded brain activity of thousands of people processing information, medical information, public service announcement during COVID. There is one basic rule. You cannot be influenced by something you never hear about, or that you can't mimic something that you do not experience. I saw governments that spend more time trying to debunk myths and to deal with anti-vax, and sometimes basing their communication strategy on what anti-vax people might think, instead of focusing on the great majority, which was not anti nor pro-vax, but just waiting for a solution. They were so loud, those anti-vax, that we thought they were everywhere. Mm-hmm. And guess who amplified their voices? Mm-hmm. Guess who gave them a mic to speak? Not me.
Yep.
Can I just say a word in favor of the medical communities and decide there are bad doctors and good doctors, and good doctors, and the good doctors are the ones who can listen and can actually communicate in an empathic way. And I think one of the things that came out of the pandemic is that many doctors weren't good communicators. And so there is a need, and I'm myself teaching at university now, the importance of learning how to communicate to the largest public. Similarly, I would say some of journalists out there, they didn't have information about the scientific elements of an epidemic, a pandemic, and voluntarily or involuntarily spread wrong information. Now, investing in a school of journalists to train future journalists about pandemics and epidemics and how to manage it is very important, because their role is critical. And if you go one step up from the very beginning, politicians. I strongly believe on the importance of bringing the example of COVID and other epidemics, pandemics into school of politics, so that the new generation comes up with a better understanding of the importance of scientific evidence and how to manage that uncertainty where you don't have actually very clear scientific evidence for the benefit of the population. So there's a lot of work that I think can be done at the various levels of the society to try to identify a narrative that can actually work.
So I'm going to ask one more round of a question here, and then I'll open it up for questions. So please be prepared to ask as you'd like. So looking, we're here in Davos. It's the largest global business gathering, and I often, have encouraged my partners in the past, my clients now, really to use Davos as a chance to kind of uncover a blind spot, right? Don't come to Davos just to talk about what you know, but try to figure out what you don't know. So, using also a nice Greek metaphor, I'm wondering if you could describe the Achilles heel of the business community. Perhaps some of you are here today as we head into the future and deal with this topic. What is really the weak spot? What is the blind spot, the Achilles heel that they need to address in order to get a better handle of the misinformation, disinformation landscape? Any takers for the question first?
So I think that and I just want to stipulate, I get bad actors have easy access to technology that can have just unbelievable impact. So that's an Achilles heel that needs to be addressed, but more strategically and institutionally. This is only going to get fixed if business and government partner. And we talk a lot about public-private partnerships. In the context of healthcare, the complicating factor is the regulatory relationship between government and business and the healthcare business, okay? And the constrictions, quite honestly, on business by regulations. They're important constrictions, they're for safety and all that kind of stuff. Business needs to absolutely rethink how they engage with government, because we need our public health institutions to be more trusted. They cannot do it on their own for all sorts of reasons. Like you said, I'd rather have the CMO of Walmart working on it than a medical doctor in partnership with a medical doctor. So business, because they're more nimble than government, they need to completely rethink how they partner with government about this, and they can't think of them as their regulator.
Olivier, do you want to maybe also comment on the Achilles heel vis-a-vis technology and AI?
The same one as pre-AI era, which is, it's not because you're telling the truth that you have to amplify it, and that people don't believe the truth. They believe a good message. Communication is a science. And 10 years ago, it was very difficult to record brain activity of people receiving messages at scale. Now we can do tens of thousands of people at the same time, as we did during COVID. And don't trust what people say, because most of the time, when you ask people questions, they give you an answer because this is what we do. If you ask me 3 times the same question, I'm going to give you an answer at some point, at least to get rid of you, even if I don't know anything about the topic. And even if I'm answering in good faith, I might not have access to the mental processes that lead me to prefer something or to trust. And they need to invest, the business needs to invest even more than the government in reliable tools. We can leverage data at scale like never before. We see governments that are using the technology they are funded in public universities in order to better communicate. But the very one thing has nothing to do with technology, is do not give your opponent an information that can be weaponized against you. And I'm going to end with the uber bad example of a French government at the very beginning of COVID. The spokesperson of our government came out publicly because we were lacking masks, and she said, masks are useless. That sentence has been weaponized against the French government for more than 2 years, undermining every good effort of communication from President Macron to the entire health community. One sentence. And this is where, for someone who speaks a lot, it's a bit of an irony to advocate for silence.
Yeah. that was at the very beginning, that was a moment in which wasn't absolutely clear, and that was silence would have been better than speaking. But that's exactly one point where uncertainty can lead to a big mistake that then it takes years to recover. I wanted to say, know your audience, and in order to know your audience, you need to listen. And I think one of the biggest mistakes that I've seen in the past is that we have vaccines, we do have the medicines, we just go and the companies just push them. And if people don't want them, they will not be vaccinated, they will not get medicines. And so understanding the audience is very important. The WHO is working with AI technology to scan communications that are online around pathogens, respiratory pathogens across countries. And they are trying to find out what people are saying online. And by scanning that, the WHO is able to identify that there is misinformation going around a certain level and intervene quickly to try to dispel that. And I think that starts from listening, which is a very different approach from top-down providing information. So listening is also for good doctors. The good doctors start by listening to their patients. Also on a global scale, listening is key to rebuild trust. Think about your wife, think about your husband. That's when trust is built. And so listening is, for me, critical at all levels.
Valerie, I have a question for you, but I actually wanted to open it up first to the floor to see if there was any questions from the audience gathered. Any takers? All right, I'm gonna give you a couple more minutes to think of one. But what do you think then is the burden of the kind of consumer of the information, right? You mentioned to check the 3 sources, but what can we do now that we're having such a multiplication of the sources in this AI environment? What is your suggestion to the average person as they go about their lives on how they navigate this as they consume media? And I'll just say one thing. I feel that in my experience, I only really learned about how media works when I went to communications graduate school. And instead, growing up in the US, I had loads of drug education classes and, all these different subjects. Obviously, you need to have the other subjects, but I was never taught how to consume information and how to and so I assume that there are initiatives starting here in terms of how to teach the next generations on this. But I was curious, yes, I hope. And if anyone knows of those, we'd love to hear that. But from your perspective, what is it kind of in our average daily lives, what does this mean for us?
Well, I guess speaking on behalf of average people everywhere, I think that it comes down to just being responsible somehow for the information that you're taking in. I mean, kind of using a bit common sense in that sense too. Don't drink the bleach. I mean, does that sound like a good idea if you really think about it? That sounds like a terrible idea. So, be more discerning in the information that you consume. And in a sense, I would say, let's try not to be, don't take the first thing that comes up in your Google, take a minute to think, to question and be like, if this doesn't sound exactly, and like I said, maybe just confirm, say, all right, I've read this here. Where else will I find this information? Is there anybody else who is saying the same thing? But it's tough. Oh my God, it's tough. There's so much media out there, and especially for young people. That's why we say, I really hope that there's going to be something that supports young people in their consumption of media, to tell them, hey, TikTok isn't always right, or, can't be perhaps your only source of information, maybe try to again, just check, I don't know how to say it other than, just be responsible also for the information that you consume.
Go ahead.
Can I just telegraph?
It was a good piece of advice, I think.
I don't know. We'll see.
Just telegraphic. Google entered into an agreement with the World Health Organization by which in every country of the world, whenever there would be somebody Googling about COVID, all the right information will be coming. So if you were from Athens talking about, you will get the information linked to the Ministry of Health, all up,
That's
and
awesome.
the misinformation will be away. On TikTok, I was with the Red Cross when COVID happened. We went on TikTok. I spent a lot of time on TikTok talking to 12 years old about this. Go into their space, listen to the question, try to respond, be honest, and connect. And I think understanding the audience and changing your messages according to the different audiences is critical.
Yeah, that's a good point.
Olivier, did you want to come in?
I will just...
I sense you have
No, I want to build...
Afraid.
No, I want to build...
brainwaves.
I want to build on what you said.
Oh, good. All right.
Absolutely, embrace it. Be responsible about what you share. This is my advice for individuals and media. Debunking a myth is sharing about the myth. People who never heard about it are going to hear about it for the first time, and there is a chance they will believe it because you deny it. Silence is the best option. Again, one cannot be influenced by something they never read. So the bleach incident, many other incidents, do not communicate about it. On social media, I never repost something to oppose it because I would advertise the idea I oppose. And how many times have I felt in that trap on panels just to win a rhetorical battle? You know, to elevate someone who had no science to a level of interacting with me as a scientist. It's a bit like inviting on a TV show someone who's against climate change and giving that person as much airtime as someone who's defending the scientific truth. Against climate change is less than 0.3% of a scientific literature. How come these people end up having half of the time on a TV show? This is irresponsible, and this is in the hands of people who decide what to communicate.
So I have a bit of a far out question that was not prepared. So let me give it a go. We spoke about myths, and I was reflecting that we're in Greek house, and myths are a good thing for the Greek culture, mythology, and that was, I think you've already mentioned it. It was what inspires us and takes us beyond the realm of our realities. And so I'm also wondering, do people want to know the truth always? Is there something about that?
Lie to?
Because I think we've spoken a lot about specific cases with global health where clearly, like, you don't want to drink the bleach and you want to protect yourself. But in other cases, is there something to be said about actually being told a different story that builds up your outlook and your hope for the future?
I'd like to respond to that. People do like myths, and some of the culprits of mythologizing are companies. And their company, actually, if you put it in a healthcare context, an example for me is a couple of years ago in China, that we were talking about this the other day, Emanuele. In China, there was an epidemic of patients showing up at their doctor's offices and physically attacking their doctors with incredible frustration about whatever what was there, what they were told. We worked with a medical device company that this was a business risk because literally they couldn't sell their products and their devices if there was violence. And we did go and find out that what was happening was that people in China, if you were, in your 30s or 40s in China a few years ago, you started your life and your relationship with healthcare was maybe a barefoot doctor because you probably lived in a rural area because 30, 40 years ago, 80% of the population lived in rural areas. And what had happened is as they had modernized and, sort of westernized, they were subject to mythology from the healthcare industry about the miracles of health. I'm being a little bit provocative to call it mythology, but how the healthcare industry communicated, set their expectations that I take a pill and I'm done. Okay? And it's not that easy. And so again, I'm not suggesting bad motives on the part of corporate communications of the healthcare industry. But when we talk about mythology, when we talk about people, how could they come to this conclusion? Again, we got to look at ourselves as well and ask ourselves what we need to be doing differently.
Emanuele, did you want to comment on that from what you've seen from also the field and in a global health perspective?
I think it's very difficult to accept bad news. And that you have to believe that there is a virus spreading around that may kill a lot of people and you will need to stay at home. It's difficult. And I think there was a resistance. I felt encouraged by what happened around the world, but many responsible citizens took over the responsibility to protect not only themselves, but protect their families, their communities, and in a spirit of solidarity. That part of the story, which is the part of the story that is more silent, that is less visible, is also the part that is more inspiring, I think, for the future. And I want to look at that part, which is the part of shared responsibility, of solidarity that emerged very strongly in many corners of the world, of collaboration, technological and not, that really took us out of the pandemic. So I want to be looking at the positive side, despite not ignoring all the negative that is out there.
Great. We have time maybe for one question, if there's any from the crowd.
If there's no one else. I'm curious, we talk about consuming that information and we talk about spreading. I'm curious, Olivier, maybe this is specifically for you, the psychology about sharing. And because we as communicators, we want our information shared, we want our story shared, but it seems like the misinformation gets shared so much more easily, so much, and just what's, I know a lot, but what's behind that? Is it a feeling of community? Is it, do you have insights on it?
One of the reasons misinformation and disinformation travels is because some people believe it. The reason they believe it is somehow it echoes some of their thoughts, some of their beliefs. And we have a reward system in the brain. Most people have heard about dopamine rushes. But when you hear an information that you guessed was right and that is confirmed by people, what is often referred to as the confirmation bias, there is a neurochemical system that is amplifying that. And if on top of that you see multiple people around that are doing it or believing it, it amplifies it. Just like in the news, right? And this is how it travels so fast. Plus, we're bearer of bad news. We've been educated by bad news being presented to us more than good news, again, in the media. Look, after a terror attack, how many times do we see the face of a terrorist and not the face of the victims? There is something that is very telling about who we are as consumers of information. And the worst thing that can happen in those situations is to think, oh, those stupid conspiracists. You know? No, we need to walk in their shoes. We need to understand why they think this way. And then how their brains function. And then we can fight them cleverly. Otherwise, if it's just us with our knowledge and thinking, oh, they're wrong, it's stupid. Yeah, but they're winning a lot of battles these days. And they're leveraging technology a lot more than the good people, if I may say.
Fantastic. Well, I think that was a great note to finish on. So, Olivier, you've
The last word.
Yeah, you've won the last word. So he's won the
silent,
prize of. He sees into all your brains tonight, by the way, and is feeling very confirmed. So yes.
Dopamine right now.
Yes, I feel the dopamine rushing around the room. So thank you so much. Thank you to the panelists for
Thank you
joining.
for having
Thank you. Thanks, Katherine. Thank you, Katherine.
Thank you to Greek House for hosting Weber Shandwick. And I'll just throw in a word for Greece. Vacation there in the summer. It's the most amazing country. So